Hey everyone, Dr. Leigh here from Your Vet Online, and today it's Ask Me Anything. So if you've got a question about your pets, your horses, maybe some farm animals, now is your chance to ask all those questions. And isn't it a funny day today? We've got Facebook out, we've got Instagram out. So, hey, let's be here on YouTube. Great stuff. So the idea is if you've got a question, then you just write that into the comment section in there and I will answer it. So you can ask me anything. It can be about nutrition. It can be about a health issue that your animal might have. Perhaps you've got a behavioral problem. Just whatever you've got, just ask it. So it's no problems whatsoever there. If you haven't met me before, you're unsure what this channel is all about, my name is Dr. Leigh. I'm a veterinarian with over 20 years of experience, and I run Your Vet Online. Your Vet Online is a 24/7 telemedicine service. And so that means we have vets that are online 24/7 to help you with any questions you might have about your animals. So you can have a full consultation with them and get the answers you're looking for. And in some circumstances, we can provide prescriptions. That's generally only Australia at this stage, but we never know what laws might change. So keep that in mind. But yes, this channel is all about helping you with your animals. So we have lots of things that we can help you with. Righty ho, hi there. Looks like we've got a question already. That's fantastic. Hi. Okay, can pups have calcium deficiency? Yeah, I'm sure, yes, they can. However, if you're feeding a reputable brand of puppy food and you're feeding the bitch that brand of food as well, then it's highly unlikely that your pups are going to have an issue with calcium. I'm not sure what age these pups are. Maybe you can just let me know how old they are. When they're on their mum, absolutely super important that you make sure that you're feeding the mum an appropriate diet. So we actually don't recommend that you feed raw to breeding bitches for that reason, because it's very, very hard to get the correct amount of calcium and phosphorus in that diet without, unless of course it's professionally formulated by a veterinary nutritionist exactly for that dog. So we actually recommend that you feed a kibble, and it's got to be a puppy brand of formula. Sorry. So any of the sort of the good brands out there, your Purinas, Royal Canin, Hills, any Eukanuba, Advance, any of those brands are really good, and they have some really good puppy diets. And it sounds really weird that you should actually be giving them to your bitch, but the whole idea there is that she will then have enough calcium, because remember, when she's lactating and the puppies are drinking, she is losing a lot of calcium in that milk, and she's leaching that out from her bones. So unless you're feeding a diet that's really high in calcium, then she's going to really struggle. And that's when you get to see problems such as milk fever in her. And just quickly, I'll go over what the signs are with that. So milk fever is when the first signs are that she gets a little bit depressed, maybe goes off her food, she might get a high temperature, and then she'll start shaking, and she'll start sort of like little shivers and shakes, and that can be a real concern. Now, if your pups are a bit older and maybe you're weaning them onto normal puppy food, again, we recommend you buy a puppy breed of kibble for them. Again, raw diets really need to be avoided in puppies. I know lots of people will say, oh, no, that's just stupid. But look, puppies are growing. And unless you get these diets formulated by a veterinary nutritionist, it's very, very, very hard to provide the right amount of calcium and phosphorus in the correct ratio. So I really can't recommend that. But oh, he's 15 weeks old. Okay, let's have a look here. So, yeah. He's always looking kind of trying to eat rocks. Okay, all right. Well, yeah, so it's probably not so much the diet. It's probably more just a puppy thing. And yeah, try and avoid those rocks, because not only does it ruin their teeth, but one of the biggest jobs I actually get is actually removing rocks from dogs' abdomens, having to do surgery. So it's not a fun surgery. If we get to it early, then yeah, often it's okay, but you don't want to be putting your dog through that. So if you can avoid that, and yeah, I know that's sometimes easier said than done. So good luck with that. But generally speaking, I would say that there won't be an issue with any kind of deficiency in calcium or anything like that. Like, I know that you will Google and everything, and they always say, dogs that lick or eat the grass or eat dirt or eat their own poop have deficiencies. That has actually never been proven to be true. If someone can find a paper that it is true, share it with me, because at this stage and at this point in time, I have never come across a scientific paper that can actually prove that point. So yeah, great question. Thanks so much for that. So if anyone else has got questions, make sure you ask them now. I'll be here for a little bit. I've got some prepared questions that other people put through into via email, so I'm going to start answering those now. What have we got here? Okay, so this is one that came through via email from Arish, and he said his cat's not eating much food but is drinking lots of water. Now, this can be a multitude of problems, of course, and it's very, very hard to give you an answer just on a very basic, that's all I know. So we'd have to do a proper online consult for you to get more, for us to provide more information for you and to go down the right track. And that's actually a really interesting thing. Like, an online consult, we can often really pinpoint the things that you need to investigate. So sometimes we can absolutely solve the problem, and sometimes we will then advise that you need to go to the vet to have specific diagnostic tests performed. And no, it's not doubling up on money, or, you're going to have another consult, because we provide all that information to take with you to the vet. So you just need to ask to have their bloods taken or their urine taken, and to have their examination done. You don't have to go through all the other problems that you've gone through with us. Anyway, back to the question. So I'm going to just take this as what we should think about with an animal that's drinking lots of water. Now, there's a few things this could be, and I guess the most common things that we have to think about in a cat, and I don't know how old your cat is, are things like kidney disease, things like diabetes mellitus, things like hypothyroidism, and even an urinary tract problem could be causing these issues. So when we try, sometimes it's very easy for us to think that our cats are drinking a lot. So always keep in mind that a cat needs about 50 mils of water or fluid per kg per day. So over the course of the day, if you've got a 4 to 5 kg cat, you're looking at about 200 to 250 mils of water that they'll need to drink per day. And that's without them doing anything. That's just to rehydrate, keep them happy, and they're a normal cat in a normal environment. Now, when we are worried that our cats might actually be drinking too much, sometimes it could be that you're seeing them at the water all the time, or they're playing in it, because I know lots of cats love to play in water as well. So sometimes it's good to actually check how much they're drinking. And the way that we do this is we make sure that they've only got access to certain areas of water. So if they would normally say, if you had a tap normally running or something like that, remove that for the day and just provide bowls of water as you normally would, but measure how much water is in there. And then, so put out, say, 400 mils at 8 a.m. in the morning, measure how much is left at 8 p.m. at night, then refill it, write that number down, refill it, and then measure again how much is left at 8 a.m. the next morning. And that can give you a good idea of how much they're drinking in that 24-hour period. Now, there's definitely don't restrict water. So if you think they're drinking more than 400 mils, even put a litre out in different places. So they've always got an option and a choice of where to get their water from. And the big thing with this is if you're finding that your cat is a little bit dull, maybe they've gone off their food, never ever leave it longer than maybe a couple of days without food. If they're nibbling, that's okay. But sometimes I think you are better off getting to the vet, working out what the problem is. And if they're drinking a lot, you definitely need to go to the vet because you are going to need to have some examinations performed and some diagnostics. And we usually take a urine sample and a blood sample. And when we compare those samples, what we're looking for is signs of kidney disease. Have we got an elevation in glucose? Or are we actually got no glucose? Does our urine, is it concentrating adequately? If it's not concentrating well and we have a blood test that is high in urea and creatinine, that's a very common sign that we might have kidney disease that's happening. So we've got to look at all these things, and we might check our urine for infection, all those sorts of things. So always, if you find and you think that your cat's a little bit dull, they're drinking a lot, you do need to get in touch with a vet. But thank you for that question, Arish. I hope that helped you. Okay, then we had, if anyone's listening in, if you've got any more questions, make sure you pop them in the little box and I'll answer them. And our next question is about budgies. My budgies, oops, I think I had to cut and paste this so it fitted in properly and I missed out a few words. But basically, Josh was asking, my budgie's feet are getting thin and red. Is this Bumblefoot? Yeah, it sounds like it might be the start of Bumblefoot. Now, Bumblefoot is basically the common term for pododermatitis, and pododermatitis is a fancy word for inflammation of the foot. And basically it happens in budgies and cockatiels and glass and ducks, and it can be quite common in quite a few birds, and it's really, really nasty. It can start off and painful. Like, we've got to remember this is a painful condition for these birds. So what we need to do is when it's just at that very early stage where you're just seeing a bit of thinness and it's red, then you might be looking at getting your vet to give you some pain relief for the budgie, and also make sure that you are making their perches nice and soft and comfortable for them to grip onto. So if your perches are, so like with my budgie, Nigel, who's sadly no longer with us, I used to use, perches just made from branches because they were pretty cool, and he liked those. But if I had those and then I saw that he was getting Bumblefoot, then you'd have to consider putting, wrapping those up with some soft material, just so that when they're gripping, that it's a little bit softer for them and they're not putting pressure on their feet as much. Just be careful about what sort of surfaces they're walking on, that sort of thing. Now, you may be able to help these birds get over this without doing much more than that, pain relief, by improving their diet. So a lot of the times with these birds, they're getting bumblefoot because they've actually got a vitamin A deficiency. So it's really important when you've got budgies or birds of any kind, you make sure you get a properly formulated bird food or crumble. There's lots available. Just make sure that it's just not a total seed mix. Seeds are great, but they're like crack for birds. You want to have a low amount of seed, but you want to have a diet that's fully, it's got lots of vitamins in it, because a lot of these seed-only diets don't have all the vitamins they need. Now, the other thing that's really important is that you actually get your birds used to eating fresh greens and fruits and all that sort of thing, birds don't really have taste buds as such. We don't think they taste in the same way that we taste. So it's not so much that they are not liking what you're giving, but it's just that they're not used to eating, greens and that sort of thing. So it's something, if you've got young birds, you've got to try and get them used to eating greens. And greens that are high in vitamin A are those ones like kale, like broccoli, what else we got? Parsley, fruits like mango, carrot. Just be mindful that with fruits and things like carrots, which are high in starch and sugars, things like sweet potato, that sort of thing, that they can be a bit fattening too. So just be mindful of that. But plenty of greens is really, really good for them. And you might find that you might get into a routine where you might feed them, say, greens in the morning, and then their crumble, their bird pellet crumble in the evening, so that they're making sure that they're getting all those good nutrients. Now, if the feet become quite swollen and they're starting to get a bit yucky and mucky, it may be that they've got an infection. And in those situations, you'll definitely need to see the vet, because they'll need to put your bird onto antibiotics. So I hope that helps with that one. But I definitely think that, yeah, you're probably right. Your bird is looking like he's getting bumblefoot. Okay, if you've just tuned in, if you've got any questions, this is a free-for-all, so you can ask whatever question you like. Just put it into the comments section and I will ask it. Okay, this is an interesting question from Rhonda. Now, she'd taken her dog to the vet, and because they were a little bit unwell and acting a little bit strange, and the vet stuck her finger down her dog's throat. And there was a little bit more to it, where she said, after she was doing this, the dog was reverse sneezing and doing a few things. So, and didn't seem too happy about that. But I guess the thing was, she was wondering whether it was normal and why a vet would do this. And it's actually a really interesting question. So hence why I'm going to share it with you guys. So when a vet puts their finger down a dog's throat, or a cat's throat for that matter, we're checking to make sure that they can swallow. We're basically trying to see whether they have a gag reflex. So if they go and they don't like it and they act really weird, we can be assured that they do have an appropriate gag response. And yes, they are able to swallow, and they're able to do that properly. So we've got to remember that we have lots of nerves all throughout our body, and different cranial nerves innervate different areas of our face and our head, and we call those the cranial nerves. And the cranial nerves that are responsible for swallowing are cranial nerve 10 and 9, well, 9 and 10, and our hypoglossal, which is our tongue. So I can't actually remember what that one is. Yeah, I'm having a moment. Sorry, guys. But anyway, so 9 and 10 are responsible for swallowing. And some conditions will make it difficult for the pharynx, the larynx, and the esophagus to work. So the innervation to that muscle, those muscles may be depressed. So when a vet is looking at this, we're trying to work out, are those cranial nerves active and are they acting in a normal way? So conditions like megaesophagus and conditions like paralysis tick issues, and I know, Rhonda, you said you were from Queensland, so ticks are a big issue in that area. So your vet has actually been really, really thorough here, and it's really great that they did that test because they're trying to work out if your dog is able to swallow, then we can rule out that a particular problem for that area. Doesn't mean the animal is definitely not got something, because as you know, say with tick paralysis, it's a progressive problem. So if when a tick squirts and it's, it's toxin, that it actually gets worse over time. But when we actually when we do the test, we'll know, okay, that dog is still swallowing or that cat is still able to swallow, so that's good. So at the moment, we can say those nerves are functioning normally. And if they change or progress or do something over time and become depressed, then we know that we've got issues, and we might just need to actually just do something about it and look for other things that could be causing the problem as well. So I'm actually really happy that your vet did that. It means that they are really, really thorough. So well done to that vet. Now, the fact that your dog started reverse sneezing and carrying on after doing that is just the fact that it was a little bit irritated by having someone's finger stuck down their throat. A reverse sneeze, I'll put a link in the description later, but I've got a video that describes exactly what's going on with reverse sneeze. So you might find that interesting. And all it means, I would say, is that your vet just irritated a bit your dog's throat a little bit. And it's they've either irritated it or there's something else there that's been going on the whole time, and it's just still continued to be irritated. So I wouldn't be too concerned by that. But all in all, I'm actually really, really happy that your vet did that test. Okay, if you're watching and you need to ask a question and you've got a question that you've been dying to ask it now. We can answer questions about cats, dogs, guinea pigs, rabbits, horses, cattle. Yeah, any sort of questions you've got. Right, we've got a question here from Mary. Let me have a look. This is a really interesting one too. This question is another kind of neurological question. I've been getting a few of those lately. So Mary's got an older dog who seems really wobbly and holding his head on the side. Now, basically the dog was still happy, but just sort of going around in circles. And as I said, I had to shimmy a bit of this, get rid of some of it so that it would fit into the screen. But yeah, I have a high suspicion that what's going on with your dog is a problem called old dog vestibular syndrome. And basically, it could, because he's an older dog, that's probably the most likely thing. The other thing we sometimes call it is canine idiopathic vestibular syndrome. And the other thing is sometimes with these dogs, especially if it's a younger dog that has these sorts of signs where they're holding their head on the side and doing, walking in circles and stuff, we've also got to make sure that we can rule out other things. So has your dog got an inner ear infection or something else going on in that ear? Has he or she had medications that are what we call ototoxic? So those are medications that have gone into the ear and have actually killed off some of those really crucial little ear fibers, like the little fibers and things, so that the dog, so we don't have that hammer and sickle action that makes us be able to hear things. So has there been medication in there that's actually disturbed all those and killed those off? Just for interest's sake, a lot of gentamicin type products are ototoxic. And if you're ever putting things in your dog's ears, I'll just have to say, please don't. I see so many comments in Facebook groups and things about treating dogs' ears when they've got infections and stuff. And it's like, oh, guys, just don't. Like, there are not very many things that aren't what we call ototoxic. So you putting stuff down your dog's ears without guidance from a veterinarian is pretty dangerous. So I just have to say, I really would hope that if you've got questions and you're worried about your dog, you'll use an online vet and just get some advice rather than take the advice from, friends, family, Joe Blow down the road or the breeder or whoever who is not trained to understand, like, have they got a degree and they know pharmacology and they know what things are ototoxic and what aren't. Just because something worked in their dog does not mean it's going to work in yours or cat or horse or whatever. So just be really mindful of that. So what else could it be that makes this dog do that? We could have trauma, any sort of injury to the region around the ear can cause issues like that. Tumors. So sometimes with these older dogs, it actually may be a tumor pressing on something. And I'll just talk about treatment shortly. But if our treatment takes or doesn't make any improvement, that's when we're going to start thinking about maybe we should do some further diagnostics. So we might have to do an MRI or a CT scan. Other things. So, and the other thing that can sometimes cause this is hypothyroidism. And that's one of those strange diseases that get a lot of problems with a lot of different things. And so far too complicated for a chat here, but just be mindful that it could be all those things. So when we're presented with an older dog with this type of problem, generally speaking, we think it is the geriatric idiopathic vestibular syndrome. And so we're just going to look at monitoring to start with, especially if there's been no access to toxins, there's been no access to anything else, you haven't put anything in their ears or anything like that. We generally would just go onto a symptomatic approach. And for a lot of these dogs, they often find it really hard to stand up. They find it hard to eat because they don't know where they are necessarily, and they get really nauseous. So we often have to keep them in hospital. And we often have to put them on fluids so that because they can't drink, because they lose their ability to be able to swallow sometimes as well. And they feel so nauseous that sometimes any sort of food just makes them want to bring it up. So we give them anti-nausea medication, we put them on fluids, and sometimes we feed them by hand with, like rolled up clumps of soft food so that we can help them sort of gulp that down as easily as they can. So it's more of a time matter with these guys. The vast majority of them see a lot of improvement within the first 72 hours, and then hopefully I'd have to say the majority are much improved after 10 after about 10 days. Some dogs, though, the symptoms of wobbliness or circling and stuff just persist. Now, I guess I would be, if I sort of wasn't seeing a good improvement and there were some other symptoms and signs that maybe it was not well, then I would be pushing for a CT or MRI. But it doesn't necessarily have to happen. And we just need to remember that some of these dogs always might have a residual little head tilt or just move in that slightly different way for the rest of their life. And that's okay. So we don't have to stress about that. I guess the main thing with this vestibular disease is that we don't rush them. We provide them a little bit of symptomatic care until they can sort of learn to either live with it or get over it, which is always good. All right, then. Well, it's been half an hour. We've had a few questions. Thank you very much, everyone. And, I hope you got something out of that. Each Tuesday, we provide tutorials on this, plus our YouTube channel, of course, has other videos. So if you're scrolling through and have a question, just go and do a little search within our page in YouTube there, because we probably have done a video on it, because we love helping you guys. And just remember, if you've ever got a problem, our vets are online 24/7. So there's no appointments required. You basically go in, book, pay the amount, which is $49.95, and then you're connected with a vet. So nice and easy. All right then, guys, I'll catch you next Tuesday. We'll have a little topic to talk about then. And yeah, hope you enjoyed today. Tell all your friends about it. Make sure you subscribe to the channel so you get some reminders too. All right then, guys, you have a great one. We'll catch you later. Bye.